In Springfield, Missouri, coronavirus hospitalizations are up more than 225% since the beginning of June. The region's two major hospital systems are once more worried about being overwhelmed.
It appears to be related to the Delta variant. We began to get news of the Delta variant about 5 weeks ago.
The Delta variant, the same variant blamed for the catastrophic surge of COVID cases and deaths in India, is quickly becoming more prominent in the U.S. At a press conference this week, local health officials said it makes up 93% of COVID cases in Springfield and surrounding Greene County.
34 cases were hospitalized due to COVID-related illness in mid-May. As of yesterday, we had 155 cases hospitalized due to COVID-related illness. That is the highest it's been since January.
The hospitals report many of their new patients are young and until recently healthy. What's more, medical experts say just about all those hospitalized share something in common. What percentage do you think it is of people you have now who are unvaccinated?
In the hospital, it's nearly 100% of the people hospitalized with COVID pneumonia are unvaccinated.
Health experts say the current vaccines by Pfizer, Moderna, and Johnson & Johnson are all effective at reducing severity of illness and hospitalizations caused by the Delta variant. But the county's vaccination rate is running behind the national rate of 45%.
Of those eligible, we're at 37.7%.
You realize you're behind?
We do, yeah.
In other parts of the state, the numbers are far worse. More than 20 counties in Missouri report less than 20% of their populations fully vaccinated. Counties that voted overwhelmingly for Donald Trump in 2020.
There's been a lot of misinformation that has definitely played a tremendous role in politicizing this entire situation. And that information has definitely played a part in people's fears.
Springfield's acting health director, Katie Towns, says local health departments are doing just about anything to encourage more people to get vaccinated. Like this event at a local brewery offering free beer and a shot, as in vaccine. Will Branch says it was pressure from his family and not the beer that finally got him over his hesitancy. What was it that kept you from getting the vaccine?
Fear. I don't really have any other answer other than I was scared of a new thing.
Louis Michael wishes he'd got the vaccine.
I was short of breath for a little bit. But
he and his wife Patty both ended up in Mercy Hospital with serious COVID complications. He says not getting the vaccine was a huge mistake.
I hope people do think about getting the vaccination. It's your prerogative, but I wish I had done it to just avoid this.
Fortunately, Michael and his wife are doing much better thanks to expert care. But doctors and nurses at local hospitals say after an exhausting year and a half of battling COVID, this latest surge is having a significant impact on morale, saying it's harder to again risk their own health and well-being for someone who chose not to get vaccinated.
I think when the staff's putting themselves at risk in these situations and they feel like other people aren't willing to take the vaccine despite their risk, that's a hard one for some people to swallow.
Medical experts say if the Delta variant can take off, explode here, as it appears to be doing, it can happen just about anywhere where there are low vaccination rates. And in fact, they hope that states that have low vaccination rates are paying very close attention to all of these developments. And they also point out that this is potentially a much more contagious and much more dangerous variant. They know that they're not out of the woods. In fact, they're barely into the woods here. Things could get a whole lot worse. Aaron?